So with the book Medical Bondage, it looks at the struggles of enslaved black women and Irish immigrants who were used by medical doctors in the fields of gynecology and obstetrics, and how new techniques and procedures were performed on these women before they were performed on white women. Since when it comes to enslaved black women, researchers believe that uh, black women had the ability to tolerate pain more easily than their white counterparts. They had these so-called super bodies, and most of the time enslaved black women and Irish women had no say in how their bodies would be used for experimenting, which really highlights the idea of this early point in medicine being very dark. In terms of social determinants, which are factors that influence a person's quality of life, Irish immigrant women and enslaved black women had to deal with the issue of being forced to work for owners and being looked down upon because of their race. And that really added on to the downside of women not being seen equally by society at this early point in medicine. And and the women in bondage tried to escape negative social determinants like abuse and heavy workloads from their owners by making themselves appear as physically healthy. And because that was because owners and researchers who perform procedures on these women looked for women who were reproductively healthy to serve as um, serve as individuals who could help advance the field of research in medicine. Another negative social determinant enslaved women had to face was protecting their privacy. Because they had little privacy, they were always their lives were always being intruded by the public, and so they had to protect what little privacy they had left. And this impacted the lives of black slaves because it made them insecure about sharing their health concerns with their owners, and as a result, enslaved women were not able to gain that proper sense of treatment. And in chapter 3 of the book, um, Contested Relations, Slavery, Sex, and Medicine, it looks at the historical trauma enslaved women had to face in their lives, and the main source of that trauma was um, sexual assault by either their owners, white males that their owners partnered them with, or even their fellow male black slaves. And in response to this form of trauma, medical doctors learn how to respond to physical symptoms of sexual assault, as well as how to professionally document those incidents in medical journals. And traumatic events that enslaved women had to face frequently in the 19th century provides insight in today's teachings of how to understand ways of identifying signs of mistreatment like sexual assault. Um, and Irish women also faced the same uh, type of type of trauma with sexual assault while on boats that were headed to the United States. But instead of having the option to be able to escape and run away from that source of trauma, they didn't have that option because they were stuck on boats.
Medical Bondage by Deirdre Cooper Owens gives insight to the birth and early days of gynecology and women's reproductive health in the U.S. Owens explains the history of black women and Irish immigrant women being relied upon to advance medical research conducted by white male doctors. The use of enslaved black women allowed for rapid advancement in gynecology. These two populations of women were viewed less as actual humans and rather as objects needed for the white doctor's personal gain and advancement in their medicine. For pioneering gynecological surgeons, black women remained flesh and blood contradictions, vital to their research yet dispensable once their bodies in labor were no longer required. Owens describes a saddening reality for the enslaved women subjected to experimental surgeries. These otherwise healthy black women were seen to be of great value to their slave owners when able to reproduce, as importation of African-born slaves was banned in 1808. Gynecology is not just a new medicine, but also an avenue for the profit of slave owners in the South and for the application of scientific racism that wished to prove biological differences between white and black people as a means to justify racist beliefs and slavery. Slave owners would often abuse their female slaves, but were very aware that their reproductive health was important to continuing the existence of slavery. Owen's account of the patient Mary, a 28-year-old married black woman who went under surgery to remove her cancerous uterus done by Dr. Paul Eve in 1850, shows how even after death, some black women seemed unable to escape the ownership of a white man. As her cancerous uterus continued to be used in research after her passing that occurred 3 months after the procedure, her uterus was of more importance to Eve than her well-being and self. Both the vulnerable populations discussed throughout medical bondage were subject to a lot of trauma. Modern studies have shown trauma to increase risk of many health issues, including chronic lung and heart diseases, liver disease, viral hepatitis, liver cancer, autoimmune diseases, STIs, and depression and other mental health conditions. The trauma endured by enslaved black women and Irish immigrant women likely contributed to their health conditions. In the article, A Conceptual Model of Historical Trauma, Implications for Public Health Practice and Research, the historical trauma theory is explained as incorporating and building upon three theoretical frameworks. Psychosocial theory, which links disease to both physical and psychological stress stemming from the social environment. Political/economic theory, which addresses the political, economic, and structural determinants of health and disease, such as unjust power relations and class inequality. And the social/ecological systems theory, which recognizes the multi-level dynamics and interdependencies of past, present, proximate distal, and life course factors in disease causation. The psychosocial and political/economic theory are very relevant to the history of gynecology presented by Owens.
Chapter 4 of Medical Bondage highlights the medical experience performed on another group of women, the Irish. Chapter 4, titled Irish Immigrant Women in American Gynecology, illustrates how Irish immigrant women were like the enslaved African American women, in which there was an abundance and they were relatively easy to exploit. In a conversation of trauma endured by the Irish woman, Owens describes on page 89 that Irish women were subjected to sexual abuse when immigrating from Ireland to America. This further translates into social determinants of health, as there arose the idea that Irish women were voluptuous, and this negative stigma towards them lowered their status in the class among other white Americans. In addition, the Irish population, as a whole, lived in areas of the cities that usually had no electricity or drainage, further lowering their status among the other civilians. Because of this declassification, Irish women were more subject to gynecology experiments, especially in the North, where enslaved African Americans were not as abundant. Through the exploitations of African American and Irish women, early pioneers of gynecology gained insight and information into solving gynecological diseases for the elite woman without experimenting on the elite woman. In Chapter 5, Historical Black Superbodies and the Medical Gaze, it describes how the white society, as well as the white doctors, thought about and wrote about the African American woman in bondage. One of the big ideas that was explained in this chapter is expectation for African American enslaved women to continue hard labor after undergoing a gynecology experiment performed on them earlier by the doctors. This can cause trauma for these African American women because of the pressure that is placed on them to continue being slaves, even though their bodies have not completely healed yet from the medical procedures. Gynecology experiments had a cost, and the doctors nor the slave owners respected the amount of damage that is done to the body of the woman. This is important in our class of PPHS because we learn about professionalism and how you need to be professional with your patients, especially in a medical to patient setting and conversation. So, learning about how the doctors disrespected these women further emphasize or further illustrates the point of how important professionalism is. Also, not respecting the woman is a social determinant because this is placing a woman's life in constant labor and willpower, and they need constant willpower to sustain the needs of numerous individuals, which are the doctors and their slave owners. In addition, the male doctors identified African American women as able to sustain more pain than other women populations. This resulted in more African American women subject to medical experiments and possibly considerably more painful procedures than those that would be performed on an elite white woman. In the end, African American women were mistreated and disrespected and exploited by white male doctors to further increase their own credibility and popularity in the field of gynecology without acknowledging the contributions of African American women in these experiments. overall, I think that Owens did a great job of writing this book and illustrating this important history of gynecology that most people now or today would not really have known, um, because in the textbooks it just lists the doctors and their achievements, um, but Owens does a good job and really digging into the details, um, uh, uncovering these unknown facts and demonstrating the problems and issues um, that it would become now, and how unethical these how the doctors treated their patients and experimented on them, and there just further ties into PPHS as we go further along and learn more about the medical field and the skills of a physician, and it just shows how there's a need for to be professional, and there's also a need to be ethical about how you're performing on your patients, because as this illustrates, there, there there's there needs to be judgment from the doctor to know what is best for the patient. um, and sometimes in the African American woman example, some of them were not voluntary, they were just forced by their owners. So it illustrates an important part of and consent, and the importance of that in the medical field. So Owens overall did a great job and is in a position to talk about the history of gynecology and the issues of over credit, or or crediting the doctors without the patients that were involved in this experiments.
Keith Lehman's Heavy and American Memoir tackles the experiences regarding the quintessential American issues with weight-obsessed culture and racism, while also facilitating a dialogue regarding the tough love many young people of color experience. It provides a personal record regarding how the frameworks of which the United States has been built on harms and affects everyone through the lens of violence, racism, and toxic masculinity, shedding truth on the inequalities perpetuated through the system. A recurring theme that Lehman delves into is that of intergenerational trauma through the motives of sexual violence and physical abuse. This is primarily done through the narration of Lehman's interactions with his mother and his grandmother and their personal experiences. Historical trauma, as defined by the Mohat et al. Article, refers to the complex and collective trauma experienced over time and across generations by a group of people who share an identity. In recent years, it's become more frequent to refer to communities who have suffered and endured like a history of oppression, victimization, or a massive group trauma. Thus, Lehman addresses the shared experience through his grandmother's trauma from growing up in the South during the Jim Crow era and the sexual abuse that she endured. Upon that conversation that Lehman had with his grandmother, he comes to the conclusion that, quote, no one in his family and very few folk in this nation have any desire to reckon with the weight of where they've been, which means no one in his family and very few folk in this nation want to be free. Regarding the historical and intergenerational trauma, Lehman comments that as members of the U.S. society, many have internalized the values upholding this country's social hierarchy, which may lead some to harm others as well as oneself as they continue to consume this stereotypical American culture. With regards to social determinants of health, Heavy, as a book, facilitates a dialogue through Lehman's personal experience coming from an intellectual household with a prominent political scientist, single mother, as an African American boy who struggles with his weight for the majority of his childhood and adolescence. As stated before, social determinants refer to conditions in the environment that one is born, lives, or works in that may affect the quality of life and health. These conditions can vary from socioeconomic status to neighborhoods to accessibility to resources. And within Heavy, Lehman addresses his social determinants in regards of being part of a minority group, as well as the issues their family unit faced with his mother's gambling addiction. Lehman discusses the issues he faced once being admitted to university, in particular being dismissed for mistakenly leaving the library without checking out a book, as well as his personal struggle with eating disorders, striving to achieve what is seen as successful in the consumerist culture that we live in. And as such, those who are heavier are often more pathologized, while those who are deemed like slender are often considered in shape, though the obsession with thinness as an idea is hardly ever actually connected to an individual's well-being. Within the past couple years, there has been sort of a repeated societal narrative that there is a resolution just around the corner and it's just a matter of getting there. However, in Heavy, Lehman unmasks a lot of devastating factors that undermine how many Americans can achieve the idea of health and happiness. It exposes the realities that many people don't want to disclose or acknowledge, but it's important for us to recognize and try to reduce small, daily, and common violences that unfortunately are a national inheritance. And hopefully, through recognizing and reducing these violences, we can become more empathetic to those around us.